Good afternoon. My name is Kelly Atley, and I'm representing the communications team for Foundation Health Partners. Thank you for joining us for today's press conference and Facebook Live event. To members of the press, thank you for the important work you do in keeping our communities informed. As you know, Governor Dunleavy recently activated crisis standards of care for the entire state of Alaska. All of this in an effort to help overwhelmed hospitals. Today's press conference will provide an overview of our COVID surge as well as highlight crisis standards of care and the effect that it would have on anyone needing any kind of medical care at Fairbanks Memorial Hospital. We have several speakers lined up today. Each one will describe what they're seeing in their particular areas. We will answer questions from the press at the end of the presentations. Please put your questions in the chat box. If we end up running out of time, please redirect your questions to publicrelations@foundationhealth.org, and we'll be sure to follow up on those. Each speaker will introduce themselves and as well as identify their role within the organization. Kicking off today's event by Zoom is Jeff Cook.
Good afternoon, everyone. I'm Jeff Cook, president of the Greater Fairbanks Community Hospital Foundation and board chair for Foundation Health Partners. As I think most of you know, Foundation Health Partners is a locally owned and operated nonprofit healthcare system that operates Tanana Valley Clinic, Fairbanks Memorial Hospital, and Denali Center. Our foundation was launched with a great fundraising effort by the people of Fairbanks in 1968 to build a hospital, ensuring that our community would always have access to basic care. We feel it is our duty to let you know that this long-standing commitment to meet Fairbanks' needs is at risk because of the recent surge of COVID-19 cases in our community. Today, we would like to share with you how our healthcare system is faring in this current phase of the pandemic and the implication it has for the patients and community we serve. This is a community issue and requires a community response. Thank you for taking the time to join us and hear our stories. And now we will hear from Dr. Angelique Ramirez.
Hello, everyone. I'm Dr. Angie Ramirez, Chief Medical Officer for Foundation Health Partners. I have with me today a number of colleagues who play significant leadership roles within our institution, our healthcare system, and they're going to share details of what they see and what they are seeing now on a day-to-day basis. First, though, I'd like to share an overview of some of the trends that we're seeing with respect to the Delta variant, its impact on Alaska's healthcare system, as well as what it means for Fairbanks and the people that we serve in our community. So right now, the strain of the coronavirus, COVID, is the Delta variant. This is across the United States, it's across Alaska, and it's what we are seeing in Fairbanks. This is different. Our new mantra, unfortunately, is Delta is different. We thought we had gotten a handle on things, and it's changed. So the Delta variant is far more transmissible. We are seeing family members admitted on a regular basis. We are seeing spread that people have not been prepared for. It's also more deadly. This is not in the data, but we are seeing it on a day-to-day basis. Our colleagues in Anchorage are seeing it, and our colleagues in lower 48 are seeing it. And it's also more deadly with younger individuals, people in their 30s and people in their 40s. That's something new. So one measure that I have looked at on an ongoing basis through this pandemic is the testing positivity rate. It's not a measure that anybody else looks at probably, but this is the clue, the first thing that things are not going in the right direction. You want to have this less than 5%. Our prior two spikes, we reached a high of 9%. Our testing positivity rate this past week has been 16 to 18%, the highest we've ever been in Fairbanks. It's the clue that we are still on a surge going upwards. This is the measure that first is your first sign that things are not going in the right direction. It's followed by increases in cases, followed by increases in hospitalizations, and then lastly, followed by increases in deaths. So unfortunately, we're still not going in the right direction. We are seeing more COVID patients in the hospital. We are seeing more COVID patients at First Care, our urgent care clinic, and we are seeing more COVID patients in the emergency room. We also know, many of you have seen the lines at Capstone. and how long they are and for testing. And so all of this is just to say it is a significant problem in our community right now. Part of any surge planning, which we have worked on from the beginning, is always looking at the 3 S's, staff, stuff, and supplies. So shortages in any of these areas can throw you into crisis and make you unable to care for patients. So supplies, we've been semi-okay on. I will say our biggest challenge at the beginning and still today is the availability of testing and rapid testing. But, we're getting by on that. Not great, but we're getting by. In terms of space, we've made a lot of changes lately that we've been required to do because of the impact of what we are seeing. So we are recovering patients in our perioperative care area. We have stood up an extended recovery area so that patients, rather than being admitted into an inpatient bed, are being recovered in the perioperative area. That area is also serving as our surge ICU space, and we have done test runs of patients so that we can provide care there. We have, on occasion, boarded ICU patients in the ED. We have not needed to do that for prolonged periods of time, but if we have to do that again, we are ready to have a surge space to put them in. We have handled most of our COVID patients on our medical unit, 2 South, which has become our COVID unit. In many ways, it is functioning as an ICU step-down unit. We have become accustomed to managing patients with high-flow oxygen on that unit. We put in the monitoring to do that. We've also had patients with non-invasive ventilation on that unit. That unit has been full several times, and so we are now cohorting patients, 2 patients to a room, as well as we've converted a meeting room into a small ward room on that floor. In addition, many of you are aware, we have prepared, in case we need it, we hope we never do, but a large meeting room on the first floor of our facility to be able to serve as a ward if needed. With the increase in COVID, we've not been able to keep up with the monoclonal antibody infusions in terms of space. And so we've created a new lounge for the infusion center, which is now in our lobby space of the surgery tower. It's functioning as an infusion room. So where we're really struggling, though, is with staff. A bed without the proper staff support, pharmacy support, respiratory therapy support, meal trays delivered, environmental services who have infection control training and specific expertise. Otherwise, a bed is just simply a hotel bed. So we need staff to be able to deliver care. And that has been our biggest challenge. One of the real challenge with that is, I will say it's been a real challenge at a national level. We have been finding staff are choosing to leave healthcare at this point. They're choosing to leave healthcare because of the workload, because of the drain. And then also the other thing that we're finding is there's an extreme fatigue amongst all of our staff. We've been in this, I was saying 18 months, but it's actually something like 20, can't count anymore. It's been a long time. And it's having the impact on staff because of that. So some hospitals are having to go into crisis standards of care. And in crisis standards of care, you're not able to do everything that you would want to do for a patient. I will say at this point in time within FHP, we are in what we call contingent standards of care. We are doing everything we can in terms of mitigation strategies not to move into crisis standards of care. This is serious stuff and not stuff that we usually talk about. We are having impacts, though, and another term that I have never used before until this past month, service disruptions. We keep track of all of our service disruptions on a daily basis now so that we can try to mitigate. Some of those include prolonged wait times in first care and emergency department. We have had to pause screening endoscopies for a period. We are hoping to resume in the future, but we don't know when we will be able to do so. We are episodically having to cancel surgeries due to either lack of a recovery bed or lack of a positive COVID test. And we're having longer wait times to get some of our diagnostic imaging scheduled because we have staff out due to COVID or other reasons. And at this point, I am going to turn this over to Dr. Dillon. He's our medical director with Tanana Valley Clinic, First Care Clinic, and he's going to share with you some of what they are seeing at First Care specifically.
Thanks, Dr. Ramirez. So you highlighted one thing that I will go ahead and start out with is talking about our wait times, and the Delta variant has certainly had a major impact in that many people who are seeking care at First Care are having to wait up to 4 hours. 5 hours is not uncommon before they actually sit down with a provider. We're doing everything we know how to do to mitigate that, but again, many of those staffing shortages, space shortages, we're getting pretty creative. We're having people wait in their cars if they're more comfortable doing that, and making sure we can call them when we're ready to see them. But what I would like to point out is a pretty telling number is our last spike, which we measured between mid-February to mid-March. We had about 420 patients that we tested and evaluated and treated for COVID or COVID-like symptoms. A similar period, so 15 August to 15 September, we saw 1,713. So for people who like math, that's 400% more people. And we just don't have the space or capacity in order to meet that volume of folks. So we've learned a lot more about COVID, how we treat it and things like that. We are doing a better job in meeting that need from a treatment standpoint. But again, with that volume of people who need care, we're simply not able to meet that in what I would like to be a timely manner. And I'm certainly given lots of feedback by the folks who are willing to wait that 4 hours that they sure would have liked to have gotten care in a more timely fashion. So with that, our space, as I mentioned, is constrained. We are doing everything we know how. We've got multiple folks stacked in on top of each other in offices. We've crammed extra computers and desks into places, made exam rooms out of what was an ultrasound room or a closet. Again, we're doing what we know how to do and making sure that we are taking good care of our patients as best we can. And I would like to just touch on the types of patients we're seeing. So we're seeing younger patients. We're seeing sicker younger patients. They are sicker longer as well. So the number of folks who come in frustrated that this is 2-3 weeks in, and I was told I could go back to work on day 10. I can't work right now. And unfortunately, I don't have a lot to offer those folks other than some reassurance and make sure they don't have a secondary infection or other complication. And we are starting to see that long haul COVID, which some folks may or may not be familiar with, is really starting to cause what in the medical community we refer to as the morbidity. So we touched on the mortality, and it is real, and patients are dying of COVID and dying at a younger age with the Delta variant. But the morbidity, how sick am I, and what do I look like when I recover or whenever I finally recover, that certainly is causing another larger impact. And while we're not at the crisis care standard, we view our role at First Care as sort of the tip of the spear for our system. And with that, when we have long wait times, that rolls into our emergency department. And when someone who we may have been able to take care of at First Care presents with a complaint that might actually need an admission to our hospital, oftentimes the default when we have that large a volume of people is we send them straight away to the ED. They may not have needed that, but unfortunately with our constraints with people and staff, that's where they end up. And again, that has impact then onto how we take care of patients who get admitted to the hospital. So with all of these constraints and with this challenge, we're still working as a system. And again, I would like to turn things over here in a moment to Dr. Owen Hanley, who's one of our hospitalists, who is taking care of those admitted patients that we see. And it also is our medical director for our infusion center, as he is able to then help with our patients who we identify as needing the monoclonal antibody infusion treatment. And he'll touch base on that as well. So, Dr. Hanley.
Thank you. Yeah, my name is Owen Hanley. I'm one of the internal medicine doctors here in the hospital. So I take care of patients both in the intensive care unit and on the medical floors. If somebody comes in with COVID, my team and I are helping to take care of them. I think there's been a lot of, Dr. Ramirez mentioned a bunch of the statistics, and sort of logistical concerns we're having, so I'm not going to go into that too much. But I do want to talk a little bit about the impacts of COVID on our hospital. As was mentioned earlier, we have an entire ward of the hospital that was previously for other patients that's entirely dedicated to COVID-19 treatment. So this is, pretty unusual that one disease process would take up an entire wing of the hospital. This isn't even to mention all the other patients that need care. So there's large numbers of nurses whose entire job is to take care exclusively of COVID patients. And as they will tell you, and I will tell you, I guess from a personal standpoint, this is a really hard disease to treat, and it's a really hard disease to watch people go through. And there's a couple reasons for that. One is that it's a long, slow, and frankly awful disease to watch. People have low oxygen levels for days or weeks. We have people dying here almost every day this week with COVID. And again, I want to make an appeal to the public here that these are people that we formerly thought this was more affecting older people or people with other diseases. I'm 42, and this is patients that look like me, that are in my age group. These are young people that aren't unhealthy, and they're dying of this, or spending weeks in the hospital sick away from their families, and it's frankly awful to watch. It's slow, and it's one of the most disturbing things is because we want to limit the rate of infection spread in the community, we are limited in terms of other family and support people that we can have in here with the patients. And as anybody knows who's been sick, having your support system around you is of the utmost importance, and especially around the time of death and dying. And to have people go through this process without their loved ones around them is heartbreaking. There was a case in which a nurse and I had to hold the hand of a patient that we took off a breathing machine, off a ventilator, while his family was on FaceTime, and he had a bunch of kids that are the same age as my kids watching this, saying, "I love you, Daddy." And this is a guy that's the same age as me, and this is profoundly awful to watch people go through this. And I guess my main point in this is that people are working really hard to try to care for people in the hospital, whether that's nurses, doctors, respiratory therapists, all the support staff. And I think this is something that while we don't have a great treatment once you get COVID, we do have a treatment for this disease. And that's a vaccine, and that's wearing a mask. And without the community support in those areas, this is going to continue to happen. And we're going to continue to watch people die from this. And again, this is not just older people. This is people like me, like you. So I guess I would, I grew up in Fairbanks, and I know that if somebody was broken down on the side of the road at 40 below, anybody would pull over to help them. And this is the same thing, right? So we have to get vaccinated. We have to wear our masks, because this is what we need to do for our community. This is what we're obligated to do to help people, even if that's inconvenient to us. So I guess I would urge folks out there who are not vaccinated to do this for themselves, for their families, for families of their friends, and for your community at large. Thank you. Sorry, one other thing is that the next person coming up is Dr. Laura Bruner. She's the director of Inpatient Pediatrics here at the hospital.
Thanks, Dr. Hanley. I'm Laura Bruner. I am a pediatrician here at Fairbanks Memorial Hospital and at the Tanana Valley Clinic. And my main message today is to say that Delta is different, that we are seeing all ages impacted by the Delta variant. So we are seeing children, young infants through teenagers who are not only testing positive, but having symptoms and having illness that's requiring care. This is different from before in the past, that we didn't see kids get quite as sick or need hospitalization in the same way. And we're seeing more of that now. We're also just seeing more kids test positive. So almost a quarter of the cases of positive COVID in the country over the last couple of weeks have been children under the age of 18. The wonderful part about children and the hard part about children is they don't live home alone. So when they are sick, they can't isolate to the basement for 10 days if they're a 3-year-old. And so they share with their siblings and their family members. And the impact of that on families in Fairbanks is not small. That we're seeing parents out of work, that we're seeing siblings who are sick and home from school, and the impact on learning when kids test positive for COVID. That we are seeing kids who are needing transfer out of Fairbanks to a higher level of care, which usually is Anchorage, for treatment of their symptoms or complications related to COVID. And that I am heartened by the hope that we will have vaccine available for young children soon. So it's been in the news recently that Pfizer has shared that they will be submitting their data to the federal or to the FDA for review for an opportunity for children down to age 5 to hopefully be vaccinated in the next couple of months. So I am hopeful that we as a community can continue to prioritize how we take care of our kids in the community, and that we can prioritize families by limiting the spread of the coronavirus. With that, I am privileged to introduce Sarah Martin. She's our Chief Nursing Officer here at Fairbanks Memorial Hospital.
Thank you, Dr. Bruner. I'm Sarah Martin. I'm the Chief Nursing Officer here at Fairbanks Memorial Hospital with Foundation Health Partners. And I'm here to talk to you today a little bit about the human and the employee perspective here at the hospital. Along with all of the healthcare providers in this room and everyone that works diligently every day to serve you, we really want to tell you that we're tired and that in all honesty, we're sad. The things that are happening in our hospital and in our community are really difficult. They're difficult at work, they're difficult at home. It's personal, it's professional, and it hits everyone. Our nurses are working hard every day, as well as our doctors, our environmental service workers, respiratory therapists, pharmacists, every single position that we have in our organization to make sure we can continue our due diligence and help keep our community safe and healthy. And frankly, we need your help. We are very grateful for every single visitor that comes in the building, everyone that's here to support us and has sent accolades and food and all of those things. Please wear your mask when you're in our building. We're really having a struggle time making our visitors understand the need for that. We're trying every way we can to keep people safe. Try and be safe in the community, whether that's getting a vaccine or wearing your mask. All of those things help to slow the spread and to help us beat COVID. Our staff are working day and night, round the clock. They're changing their hours, they're flexing their child care needs, they're working nights, weekends, holidays, really to try and keep each and every one of you safe. And we're asking some of the same from you, because I think as Dr. Hanley alluded to, and all of our other providers have already stated, watching people go through COVID as a disease process is very difficult. Even within the walls of our hospital, we have somewhat shielded some of our staff. We have very dedicated departments that are handling those patients every day. They're learning from the disease process. They're every day learning how to best care for those patients and treat them with the most kindness and love and thoughtful processes possible. But it's hard. Patients are here for a long time and they need more and more resources, oxygen, medications, just even someone there to hold their hands when we can't have visitors at the bedside. We're doing all of those things to provide safe care and do our diligence to slow the spread in the community. Thank you all for what you're doing every day, and please help us help you. Next up will be Dr. Carrie Wappett.
I'm Carrie Wappett. I'm the medical director for the Women's Center at Fairbanks Memorial Hospital. What we are seeing with this new surge is different than the Women's Center. We were prepared with the first surge of COVID, but honestly did not see a lot of positive numbers in pregnant patients. We are now. There are pregnant patients with COVID in our community. Some of the sobering things that we have learned with pregnancy and COVID. Pregnancy, if you have COVID and you are pregnant, you are 15 times more likely to die. You are 14 times more likely needed to be intubated. you are 22 more times likely to have a preterm delivery. This disease, the Delta variant, is impacting our pregnant patients. How we see it here and feel it here at Fairbanks Memorial Hospital is a similar story to what you're hearing from the other providers and the other leaders, and that is space. When we have COVID patients who are pregnant, we have to ensure that their room is isolated, that there is a room that's isolated for the infants that are delivered, and this takes more space. We have limitations in staff. Our staff are working hard, but there are exposures, there are community exposures, and we have staff that are out, we have staff that are tired, and they need your help. We have limitations in our ability to transfer. So at Fairbanks Memorial Hospital, there can be complications in pregnancy that require a higher level of care. And because the hospitals that we normally transfer to sometimes don't have that capacity, we have to be prepared to care for things that we wouldn't normally do. We have to think about the implications for those infants that would be delivered and requiring that higher level of care as well. There have been maternal deaths in the state of Alaska related to COVID. It is real. And I would echo the same message that Dr. Hanley and Dr. Bruner have shared. We grew up in this community. This is our community. We want the community to get better. We want everyone to work together. We need your help. Get vaccinated. Wear your mask. Thank you. And I'll turn that time over to Dr. Ramirez.
Thank you. So I'm going to recap or summarize where we're at. I think the bottom line is what we've been trying to share is that Delta is different. We are experiencing it very differently. It's having a huge impact on our patients, our community, and our healthcare system. One thing, though, that is the same, and I want to reiterate this, I know we've already said it, but one thing that is the same is that the vaccine still works for Delta. And we see what we are seeing are unvaccinated individuals who are going through the challenging times that you heard about in our healthcare system. The other thing is, I think you heard today a little bit, is we do function as a system. And so what's happening in Anchorage also impacts the care that we're able to deliver here. We count on that, and so that we do whatever we can to keep our patients, our community residents local and close to home. But at the same time, there are services that we are not able to provide here, and we usually partner with other communities and other institutions. And right now, we are not able to do that as effectively as in the past. So this is a problem kind of across the state and across impacting all of us. At the beginning of the pandemic, we talked a lot about flattening the curve, and I was one of the people who went out and had slideshows and pretty graphs and pretty charts of the curve and new virus and no one's immune, and if everybody gets sick at the same time, it can overwhelm the healthcare system. And unfortunately, that is the same message that now at this point in time, we're still asking for help, and that we are actually seeing it for the first time. This is what we were all worried about, and now we are experiencing it. And it's not an experience that any of us have wanted to have for any of us or any of our family members or loved ones. And so at this point, there's a limit to what we can do in terms of healthcare. This is a disease right now that we require your help. We require interventions that go beyond our four walls. We are doing our best, but there is a limit to how much we can do and how many people we can care for. And so it is vaccination, it is masking. I know nobody wants to hear it. We're all tired of it too, but we really need everybody's help. At this time, I'm going to ask Kelly to take over for the questions.
All right, we have several questions. The first couple questions are from Alina with the Fairbanks Daily News Miner. What are the other changes the hospital has made to transition to alternate care strategies? And have you been responding to the requests from rural Alaska? Are you still not in a place to accept transfers to the hospital?
I will answer that second question first. We have been responding to requests from rural Alaska. We are taking transfers, I would say not on a daily basis, but almost a daily basis. These are transfers from outside our region, and usually it's to our ICU. Critical care beds have been really tight in Anchorage, and we have been one of the few places that have on occasion had critical care beds. It is hard with those transfers because the families don't come with the patients, and it's hard on the family and it's hard on the patients, but we are trying to help. In terms of alternate care strategies, we are providing care in different locations. I think right now the main what I alluded to earlier is the infusion center, and that's ramped up to 7 days a week from, I think 6:30 in the morning maybe, or 7:30 in the morning till 6 o'clock at night. And it's gotten to be a pretty slick operation, and we didn't have any of that several weeks ago. The other piece is that extended recovery area in our perioperative. That is also very entirely new. We have been hiring COVID relief positions, and so we have hired paramedics, which is a new space that we're in, and we have paramedics starting to work in our emergency room in an expanded role to help support our nurses and our physicians there. And we've also hired some COVID relief positions, non-clinicians, to work on the unit and to help, again, support our nurses in different ways.
All right, the next question along the lines of staffing. In general, are there any updates on hiring more people to FMH? And is there still no help expected from the state and the nurses who are arriving in Alaska?
So at this point, I'm going to ask Nicole, our Chief Human Resources Officer, to address the staffing questions. Nicole Welch.
Good afternoon, everyone. I'm Nicole Welch, the Chief Human Resource Officer. So we are actively still recruiting, and we are still filling positions within our community. We have new people hire daily, but we have a lot of openings too, and a lot of turnover at this point, given the daunting work that is being done here. So as Dr. Ramirez alluded to, we've posted jobs for what we're calling COVID relief aides, as well as COVID relief RNs and paramedics. And these are individuals that can come on and plug in holes and gaps to help with our care. I will plug the COVID relief aid requires no experience. It's your way as a community to come in and help us with a variety of different things that we're trying to accomplish during this time. I actually have a call at 2 o'clock today to learn more about these nurses that are arriving into the state of Alaska and how they will be allocated. We have put in a request for multiple RNs and CNAs to support us during this time, and we hope to get a return on that. We're excited about this potential opportunity, and we'll know more this afternoon.
This next question, also from Alina with the News Miner, might be best answered by Dr. Ramirez, you or Sarah Martin. Do you think having new nurses in Anchorage hospitals will make transferring patients from FMH to Anchorage more viable?
You want to take that one, Sarah?
My short answer to that question is yes. Right now, we have a daily CNO call at 9:30 every morning where hospitals talk about what their patient census is, how far over capacity they are or are not, where their crunch is, and whether it's the staff, or the space that's keeping them from being able to accept further patients. And every day the answer is staff. They need more people, not just because of vacancies or openings, but because the acuity of these patients requires so many more people at the bedside. So yes, having extra help during this pandemic and during our statewide surge would allow us to transition patients to other hospitals.
Thank you. Dr. Ramirez, this next question is for you. What is the difference between contingency standards of care and crisis standards of care? Can you give some practical examples of what implementing crisis standards would look like in Fairbanks? And this question is from Annie Berman with the Anchorage Daily News.
So these are terms that are new to all of us. We've been learning over the course of this pandemic. So contingency standards of care is when you change how you do things You change where you do it, you may change who's doing it. So the care looks different, and it's happening in different places. And that's what we're doing today. But at the end of the day, even though we're giving infusions in a lobby, even though we may have beds in a meeting room on 2 South, the care is ultimately, we're still meeting standard of care. Crisis standards of care is when no matter what we do, we're trying to rob Peter to pay Paul, we're trying to have enough staff, we're trying to have enough space, we're trying to have enough services, but at the end of the day, we do not have enough. And that is where it's crisis standards of care, where you can no longer meet standard of care. So the types of examples that would happen here would be if we could not admit patients to an ICU or a critical care bed because we didn't have enough critical care nurses or respiratory therapists to get the treatment. And there had to be decisions made about who went to the ICU bed and who went to a regular bed. And if it comes to a point where we have to admit patients to a large ward-like setting in a meeting room that doesn't have monitoring equipment, that doesn't have oxygen setups, that doesn't have all the things that we routinely have for healthcare, that would be crisis level standards of care. It means we would still do the best we possibly can. It still means we would again, attempt to deliver care, but the reality is we couldn't guarantee the same type of outcomes that we routinely would. Those are the best examples that are applicable to our setting. It also would mean in a crisis standards of care position, we're at the point where we would not be doing any type of non-emergent surgeries, non-emergent procedures, and it would only be emergencies because all the staff would be devoted to maintaining care for any type of emergencies.
And this next question will be for you as well, also from Annie Berman with Anchorage Daily News. When you said that the hospital has not been able to keep up with antibody infusions, what did you mean exactly? Are people being turned away?
So I guess I misspoke. So what I meant by that was we had an infusion center. We still actually have an infusion center. And we had 2 rooms there that were dedicated to doing infusions for patients. And the reality is we recognized that we were not able to keep up in that space. And so as the numbers crept up, and I think what happened is we identified that we could do 8 a day, because part of the challenge is that these patients are COVID positive, and we did not want them exposing any of our other patients who are getting infusions. Many of those patients are immunosuppressed, immunocompromised, which is why we had dedicated a separate place under negative pressure for the monoclonal antibody. So we quickly realized when we were starting to get up to like 6 patients a day that we could not handle more in that space. And that's when we started building the new space. We never actually had to turn anybody away. We just could convert it into, like I said, we built an infusion center in our lobby.
Dr. Ramirez, this next question will be for you, and it's from Dermot Cole. What is the estimate of how many hospitalized COVID patients are vaccinated, and what will it take to get this status reported daily?
Dr. Hanley, would you like to take that one?
I don't have an exact number. That's but I would say again the vast majority are not vaccinated at this time. I think there's 16 or 17 COVID patients admitted to the hospital, and one of them I believe is vaccinated. And I would say that's relatively consistent with what we've been seeing. Is that again the vast majority of people who are unvaccinated are the ones who are in the hospital, and certainly the ones who are getting sicker and here longer and the ones that are more likely to die are unvaccinated.
Thank you. Dr. Ramirez, do you think that you can speak to what it might take for this status to be reported daily with the state?
So we've looked at this and trying to capture this. I would say it's been a challenge. It requires personnel to review the records and find that information, and that information is not kept in a standard place in the charts. And we've had a fair number of patients who are from out of state, and we don't actually have access to their vaccine records. So we are working on this, and it'll require us to kind of make rules about we're taking the patient's word for it or not, and we just haven't taken the time to, are we only going to use the Alaska State backtrack system to verify, or are we going to take the patient's word and have a standard place? Again, it's just really time and energy that we have really all been putting into direct patient care activities.
Thank you, Dr. Mears. This next question is for Dr. Bruner, and it's from Robin with KUAC. She'd like to know, could you give more details on children sent to Anchorage or other cities for more care? How many and when?
Yeah, thanks, Robin, for the question. So I think there are a couple of things that are likely to have children transferred out of Fairbanks for care. So there are two sorts of ICUs for children. So one is called a neonatal ICU, and that's where infants that were born very small or very sick would transfer to. We do have a neonatal intensive care unit at Fairbanks Memorial, but there's a higher level of care in Anchorage. And so kids that are the smallest or the sickest infants would need to be transferred to Anchorage. And as you heard Dr. Wappett talk about, when a mom is sick with COVID, the infant may also be sick either with COVID or because mom was sick or the infant had to deliver prematurely. So infants sometimes need to be transferred to the neonatal intensive care unit in Anchorage. The second is a pediatric ICU, and so that's where children who are sick would need to go. And we have had children need to transfer out of Fairbanks both for COVID-related reasons, so the acute COVID disease, and for treatment or management of MIS-C, which is that inflammatory syndrome that children can have after COVID. So the numbers are small, Robin. It's not a large number of children, but for each family that's impacted, it has a huge impact if your child is sick, and particularly if your child is critically ill.
Any final questions? We have one. With respect to non-ICU inpatient bed capacity at FMH, the state COVID hub says inpatient capacity is 56, while federal data indicates a capacity of 81. Curious which data set is more accurate. The difference is substantial for interpreting available capacity.
So we've all had challenges with the numbers, and everybody keeps track of numbers in different ways. And that's an ongoing challenge. So Sarah Martin thinks she has the answer.
I don't know if I have an answer, but I have an answer to the question. Our reality is we are flexing that number all the time. So again, it goes back to the space, staff, and stuff. The federal numbers are based upon most likely our licensed bed capacity. And then the state numbers look at how many adult beds do we have just generally on our medical and surgical floors. So they're looking at how many patients we have normally admitted to those spaces at any given time. We do have some of our patient rooms that have double capacity and some have single. So that also counts as bed space. We are now, with the patients being isolated, forced to decrease our number of beds for those COVID patients, but are constantly looking at surge spaces. So the numbers differ because what we're doing at the moment differs. I would say right now on our medical floor, which is where we are housing the majority of our COVID patients, we would have the capacity for about 40 COVID patients if we swelled into what is a meeting room there and would be housed for 4 additional beds.
Thank you, Sarah.
And Kelly, I'll just add, I think we can get on that question. We can also get with our emergency management folks who manage that data reporting and get the definitions that are used for each one.
Perfect, and we can follow up with Dermot on that. So we have another question from Dermot Cole. Have any Foundation Health Partner personnel quit over the vaccination rule?
I'm going to ask Nicole to address that question.
So our deadline for our vaccine mandate is October 1st. So that is next Friday. At this point, we've only formally had 2 people give notice based on the exemption. We do have the mandate. We do have still several employees who have not decided at this point what they're going to do, be that a vaccine or submitting a religious or medical exemption. So it's a little bit of a wait and see game, if you will, but only 2 people have formally submitted their resignation at this point based on the vaccine mandate.
Thank you, Nicole. It doesn't look like we have any additional questions. Dr. Ramirez, would you like to provide any closing comments?
No, well, thank you for your time. And I think somebody asked me earlier this week what I wanted everyone to know. And I think it was 2 points that I shared with that individual. And one is that we're doing our best. I think the staff here, I've never been prouder to be part of a team that cares so much about doing the right thing. And they are stretching in every way imaginable, and they're doing double duty every moment. And they're doing it with compassion and caring at all times. And so I want everyone to know that. And then I think the other piece is just we need everyone's help. This is not something, this is beyond our control here in these 4 walls. And we just need everybody. And it's happened before, and I'm counting on it happening again here in Fairbanks.
Thank you, Dr. Ramirez. Mr. Cook, do you have any final comments?
Yes, thank you, Kelly. Thank you for the media and the public for joining us. Thank you to our staff. On behalf of the board, we're so grateful for the staff we have and their dedication. I'm nearly 78 years old, born and raised in Fairbanks, been through various pandemics in the past, including polio, including different flus, including mumps, measles, and other things I've had. I am so grateful for the science that produces vaccines that none of my children or grandchildren or most of the people watching and listening to this have had to worry about smallpox or chickenpox or measles or mumps or polio. It wasn't herd immunity that eliminated these diseases. It was the vaccines. And, this vaccine for COVID is safe, effective. COVID-1 was in 2002. These are not new concepts or new science that have developed these vaccines. It's been coming for a long time, and it's just wonderful that we have that kind of science. Please, Fairbanks, vaccinate up, mask up, and help us get back to a more normal life pattern. Thank you.
Thank you, Jeff. So in closing, I'd like to thank members of the press for your questions today. If you have additional questions, please send them to publicrelations@foundationhealth.org. And for those of you who are watching Facebook Live, if you have questions or comments, concerns, ideas, or suggestions, please send them to FHP communityfeedback@foundationhealth.org. Thank you.